Hey everybody. Last time I talked about macronutrients, carbs and proteins and fats. And this time I want to talk about micronutrients, the vitamins and minerals. And I think this video will just be on the vitamins. I'll do minerals later. So when we're thinking about vitamins, vitamins are just organic substances that we need in smaller amounts. And they fit into two broad categories: water soluble and fat soluble. And why is that important to think of them that way? Well, all the vitamins and minerals are different, and you can look up what the different ones do, how they function. A lot of them function as antioxidants or catalysts, enzyme catalysts. They help functions take place in our cells. And so they're little chemical catalysts. They help things happen. They speed things up. They help all the different processes that are going on in the cell. And like I said, they all do different things. But if we think of them broadly as either water soluble or fat soluble, it tells you a lot about them. Water soluble vitamins are going to be easy out and easy in. They're going to be quick to come into the body and quick to leave. They literally are soluble in our water. They come in with our food. They go through with water into the digestive system and through the membrane of the small intestines into our bloodstream. And what are the water-soluble vitamins? Well, they're the B complex vitamins and the vitamin C, so B and C. And fat-soluble vitamins, in contrast, are harder to assimilate. They need to be brought into our diet, into our digestive system, along with other fats. So they literally are soluble in the fats that we're eating, and they're stored in the fats in our body, and they can be stored in large amounts, which can lead to pathologies. It's actually fairly common in the United States, people taking large amounts of supplements for people to have toxic levels of vitamin A or vitamin E. In fact, studies done on those vitamins had to be stopped because people were having adverse reactions to even small increases in them because they're stored for a large amount of time. So if you take some vitamin C, within a couple hours, it's gone in your urine. Whether it's a vitamin actually, or if you have a little bit of orange juice or something like that. That vitamin, your body takes what it needs and it gets rid of the rest. Versus a fat-soluble vitamin, it's going to store that in your fat and can store it in toxic amounts, and it can be really problematic. So what are the fat-soluble vitamins? A, D, E, and K. So that's just one way of thinking about the vitamins, and I'll talk more about that later.